Welcome everyone to today's webinar, "To Care is Human, Why Every Role Matters to the Patient Experience in a Time of Crisis and Beyond." I am Molly Gamble with Becker's Hospital Review, and today's presentation is brought to you by three partners: JobVite, Perfect Serve, and Secure Auth. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for your question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you have on your screen. We're looking forward to hearing your questions. Today's session is also being recorded and will be made available after the event. You can use the same link you used to log into today's webinar to access that recording. At this time, it is now my pleasure to introduce our presenter today, Jason A. Wolf, PhD, CPXP, President and CEO of the Barrel Institute. Jason is a passionate champion and recognized expert on the human experience in healthcare. As President and CEO of the Barrel Institute, Jason has led the growth of the organization over the last decade into the leading global community on improving the patient experience, engaging over 55,000 people in more than 80 countries. Jason is the founding editor of the Patient Experience Journal. He also established and serves as president of Patient Experience Institute, a nonprofit providing professional certification and continuing education for patient experience professionals. Jason is a sought-after speaker and respected author of over 70 papers and articles on patient experience excellence and improvement. He received the ACHE Dean Conley Award for his article, "Patient Experience, the New Heart of Healthcare Leadership." He currently resides in Nashville with his wife, Beth, and sons, Samuel and Ian. So Jason, I want to give you a chance to say hello and thank you for being with us today.
Thanks, Molly. Really honored to be here, and I appreciate you reading the introduction that my mom probably wrote for me. So thanks. It's great to be here.
My pleasure. So Jason, before I hand it over to you, it's really my pleasure to also be alongside you today as part of Becker's first video webinar, and to kick us off by sharing some observations about the patient experience from a healthcare newsroom. So these following remarks come through the lens of the media lens. We might not be able to interact with patients like our attendees can and do each day, but we nonetheless are able to discern and pick up on some trends from across the country. I'll share three of those with you now as an appetizer for Jason's part of your presentation, which we'll get to in just a moment. The first is that healthcare organizations today are facing a need for increased focus on relationships and trust. This pertains to several stakeholders, but especially their patients and workforce. Hospitals right now see great need to get their patients back. Visits to ERs are down 42% compared to the same time frame last year, according to the CDC. And 48% of Americans said they or someone in their household have postponed or skipped medical care due to the pandemic, according to a poll by the Kaiser Family Foundation. Patients are worried about more than simply contracting the virus in the healthcare setting. People are fearful of the entire process of care before and after they are on site. Do they need to take public transit to get to the facility? Will they need to spend time in a post-acute care setting as they recover from surgery? Much like Jason will share about how every role affects the patient experience, every component of the episode of care right now is an opportunity to either heighten or decrease patient anxiety. People are also fearful about the cost of care. With sky-high unemployment, many people are eating into their savings or no longer have the same health insurance coverage they had just a few months ago. A report from the Kaiser Family Foundation estimates that 27 million people have recently lost health insurance. Most people get their health insurance through their jobs, and getting new coverage can be complicated. This all relates to my second point, which is the average patient moving forward will now be a more anxious patient. 1/3 of Americans show signs of clinical anxiety or depression, according to the US Census Bureau. The agency polled adults from more than 42,000 households between May 7th through May 12th, and 24% of Americans showed clinically significant symptoms of major depressive disorder, and 30% had symptoms of generalized anxiety disorder. These figures show a large jump from depression and anxiety rates seen before the pandemic. As you know, anxiety is only amplified in a healthcare setting, which means healthcare providers will need to plan and respond to these figures accordingly. And finally, but most importantly, none of the above will be adequately addressed if clinicians and employees' well-being is not addressed. More than 62,000 U.S. healthcare workers have contracted COVID-19, according to numbers released last week by the CDC. And each day, healthcare workers grow more susceptible to PTSD. Global research from the World Health Organization has shown soaring rates of anxiety, depression, and insomnia. Even before the pandemic, the clinical profession faced high rates of burnout and even suicide. So right now, hospital leaders are confronted with questions about how best to respond to this crisis among their own employees. What is meaningful and supportive, and what is merely a demonstrative act? Praise and applause, while appreciated, does not mitigate the risk clinicians face on their job. Many systems are rolling out initiatives to respond, including new mental health resources for clinicians. But at the same time, most systems are facing major financial distress and losses, which raises the stakes for well-being investments that are actually used and actually effective. I look forward to diving into these and more takeaways from Jason throughout the duration of our presentation today. Jason, let me now pause and turn it over to you to dive into the main discussion for our webinar.
Well, thank you, Molly. And I would just say, I think that your observations are right on target in the conversations that we have been having amongst our community members over the last now 10 weeks. I think for many might have felt like 10 years. These are the real issues that we're facing. I think the reality of the impact on healthcare in terms of our capacity to provide care and also care for those who provide care are essential to this whole idea of to care is human. And why every role matters in our conversation today is fundamental and essential to where we're going with this entire discussion. I would just say, at the Institute, we stand as a global community of practice committed to elevating that human experience in healthcare. And we believe that is grounded in the experiences you identified, those of patients and families, those who work in healthcare, and the very communities we serve. And I think we have to acknowledge the moment in which we find ourselves as well. I think in particular in the last week or so with this issue around how we human beings treat human beings. And even just this week from the Institute standpoint, we believed it was important to say we cannot stand by in declaring this unwavering commitment to human experience if we cannot ensure that all humans are seen in that light as people who deserve the same rights and opportunities, freedoms, and respect, regardless of their race, ethnicity, social economic status, gender identity, or beliefs. I mean, that is what we're talking about, whether they are on the receiving end of care or the delivery of care. And that will become essential to everything that we do. And it really does then get us to this conversation about, if we don't acknowledge that, how can we talk about this in the first place? And if we're going to speak about care, there is a poet that I admire greatly, and so many words of Maya Angelou's help inspire us in the care delivery system these days. But one that she says that's not often cited is, if you find it in your heart to care for somebody else, you will have succeeded. And when we touch on the idea that every role matters, the idea that no matter what role you play in healthcare, you help support or directly deliver the care to other people in the health system becomes incredibly vital in the work that we do. In fact, if you look at the definition of care, the way that it is framed, it's not just this idea of a thing, like of a suffering of mind, but it really is an action. And I think we have to look at this idea of care as an action, to feel an interest or concern for someone else. And I believe that's what we're experiencing in today's environment as well. I think it relates so astutely back to the things that you identified in your parts, that there is an increased need for relationship and trust, that we have to deal with the anxiousness and fear of patients, that we understand that we have to address the well-being of those who provide care each and every day. Because at the end of our day in healthcare, I always ask this question when I'm with live audiences so I can see you. How many people here on this webinar are human beings? And while I can't see you raise your hand, I'm assuming we have 100%. And the reality for us, no matter what country we stand in, no matter what health system we operate in, whatever kind of healthcare organization we're part of, we are simply human beings caring for human beings. And this becomes, I think, an essential theme throughout our discussion as well today. So I'd like to briefly frame patient experience as a concept, I think, to align us. And I'd love to start with a story, if I could, as I kind of give some examples around how people matter, how process matters, and the technology that we use matter in the work that we do. There was a story I was told by a hospital receptionist. She received a call at the main desk, and the person on the other end of the phone said, "Ma'am, I'm just trying to find out an update on Mrs. Smith. I believe she's in room 301. We think she's getting her test results back today and potentially will be discharged." And the receptionist, doing everything she could to be customer oriented and be quick and responsive to this call, calls up to the unit and does whatever she can within the constraints of security and safety, and then gets back on the phone with the woman and says, ma'am, in fact, it sounds, yes, like things are looking good for Mrs. Smith, and she should be released today. And then goes the extra step. Can we tell you where to park? It's hard to figure out where to go in our hospital. Can I help you in any way in making sure that you're here for Mrs. Smith? And the receptionist said she just heard a sigh on the other side of the phone. No, honey, this is Mrs. Smith in room 301, and nobody tells me a blankety blank thing around here. And what we're finding and perpetuating in our healthcare system is that the simplest processes, the experience that we do, the work that we drive is so essential to the processes that are central to the work that we do. See, when we talk about experience, we're not just talking about satisfaction. And we have to remove that conversation. That's part of what we do when we talk about experience. But satisfaction is simply how we feel about our expectations, about the expectations of our encounter. What we're really speaking about with experience is this idea that it is something we have lived through. And whether we deliver care or receive care, we are living through experiences in every moment. We've lived through a major and traumatic experience, a tragic experience for some in the last few weeks together. That is the lasting story we are creating. It is everything that is perceived and understood. It's everything that's remembered about what we're trying to accomplish in care as well. And it really is an integrated perspective. I think in healthcare, and I've been guilty of it from my days in healthcare operations as well, that we have operationalized quality efforts and safety efforts. We've driven outcomes in certain places and tried to manage cost in others. We've focused on what service needs to look like, all in separate buckets to manage the chaotic, dynamic nature of care overall. But what we discovered when you think about it from the perspective of experience, when you look at what that means, the reality is that all of these things, driven by the way we engage our patients and families and driven by how we engage our employees, are all part of but one experience. And we have to begin to align and connect those efforts, much like I think you alluded to in your opening parts as well. As I said earlier, it really is about bringing together the things that we need to do in healthcare around the people and how we acquire the right people in the work that we do. It's about the process we put in place and managing those clinical intricacies to engage people in those endeavors. And it really is then also about the technology that we apply in a responsible way. And we can only say, in particular, in this most recent crisis, how important we have seen the use of technology to connect people in ways we could never anticipate before. See, at the end of the day, and talking about experience, it comes down to a definition that we created as a community in figuring out what the key elements are. And it really is about interactions as human beings caring for human beings and how we come together, interactions with the systems that we create and how we ensure that happens as well. But that interaction, that kind of connectivity that we're talking about can only be grounded in the kind of organizations we build. The responsibility of leaders such as yourselves on this call, the leaders that I think you reach out to, Molly, with Becker's, are building the kind of organizations that can deliver the right outcomes for those that they care for and serve, and creating cultures that sustain and support the people that show up to work each and every day. So those interactions are based on that culture. They happen at every touch point across the continuum of care. And at the end of the day, our ultimate measure, our final measure is the perceptions of patients and family members, what they think we did. And that has to be what we're ultimately striving for. The experience that I speak of, the one that I think we need to base this conversation is really about that. That is the sum of every interaction that's shaped by the organizations we build. It's across the continuum of care, and it ultimately is influencing what our patients and families, their care partners, and loved ones face each and every day. So I'd like to talk a bit about how experience is viewed and why it matters in this conversation as well. And what that looks like, I think, for me is a couple things. And I'd like to share a story, if I could, about the birthday crew. So as we looked at the story about process up front around, how we communicate with our patients to the real impact of people, a story I was told by a food service worker who had been his entire career, 20 plus years, delivering trays in hospitals. And he went in one day and overheard that it was an older patient's birthday as she was conversing with the nurse. And he thought, well, wouldn't it be nice? I haven't seen family with her, anything to that effect. Can I bring her down and actually engage with her? Can we bring her back a birthday party? So he went down into the basement of the building where food service was preparing and said, can we get a tray and a cake? And they called up to the nurse's station and they planned, in essence, a little surprise birthday party for this woman. They show up in the room with a tray and balloons and a little cake hours later in the day, and they start singing happy birthday, and he delivers the cake to her bedside. And in the midst of all this singing, and the tears start coming down the eyes of the patient. And this is when this food service worker said to me, this is when I started slowly backing up outside the door because I figured, That's my last day working here. I just made the patient cry. And in fact, as this patient wiped the tears from her eyes, she said to everybody in that room, thank you. Thank you for acknowledging this. That's the first time that anyone has sung that song for me in 15 years. And see, when we can create people in our health system, when we can put the right people in place, when we understand every role matters, the listening of a food service delivery worker to change the experience of that patient, and the ability is about how we then have those people feel the capacity to make an impact is so significant. And I think those of us that have lived in the clinical space can say that patient was more engaged, probably followed care protocols and plans in ways because she felt acknowledged for the human being that she was. So when we think about that and we think about what matters to patients and families as they connect together, what I'd like to touch on is a couple different points of data. First, really the consumer insights on patient experience that we asked some folks about. And we found out, I think not surprisingly, I think to all of us that experience matters, that experience is extremely important. To 6 out of 10 consumers, 90% say from very important to extremely important. But the reason that it matters, the reason why experience matters and why every role matters is significant. Because when we ask them why, it's about their health first. And I think that makes sense. The reason people choose healthcare isn't because they want a product or service from it. It's about their own personal experience. It's about their health. And so their health and well-being are important, but it's also how we treat them. The way that we treat those individuals with dignity, with respect, with listening. And then, yes, it's also about being a customer. This is different for different organizations and different systems around the world, but I think still prevalent and important to consider. And from that, we really asked the consumers then what was most important, what shaped their experience. And of all the things we allowed them to think of, if you look at what came out first, listen to me, communicate clearly in a way that I can understand, treat me with courtesy and respect are what consumers are asking. And then if you go from there to give me confidence in your abilities and take my pain seriously, it is this powerful combination of the interpersonal, the need for human-to-human connection linked with our capacity to provide the best quality outcomes possible. That is what people are asking for from us. They expect us to do the care right, but they want us to connect with them as a human being so that they can participate in their care and actively engage in getting better as well. When we looked at the low end of the spectrum of what people ranked, age of facilities, amenities, good food, parking, all the things that I think at the beginning of what I would call the experience movement, when people said, we redid our lobby, we put a piano in there, we got food service and delivery, we did all these things, where people focused their efforts and actually had to spend money to do, were the things that consumers said were the least important things. But when you look at the things on the left side of what you see, the highest ranked items, these are not things we have to invest real dollars in. We have to invest time in the right people. We have to engage people in understanding what our culture is about. And that ultimately drives the experience. You see, when we ask people what essentially was a good experience to them, what they told us is it was about caring. And at the end of the day, as we said, if we're human beings caring for human beings, what people want from us in healthcare, what patients and families said are so essential is to show us that caring. So we dug in a little further, and we've recently started what we call the PX Pulse, and we've launched it this year to track the trends of how people, in particular consumers in the United States, are thinking about these issues. And they reconfirm that. A sample now, a national demographically representative sample of 1,000 people, let us know that they believe quality in healthcare is actually solid. They actually think the experience they get in healthcare is better. And when we ask them about how important the experience that they have, and this is in real time in just the last 3 to 4 months, they told us that in 95% of the cases as of this March, the experience they're provided is going to influence the decisions they make about healthcare. And when we think about the fact that we are human beings caring for human beings based on the sum of all interactions, our means for providing those experiences and those interactions are through the people we put in place, the technology we use, and the processes we establish. And when we begin to link those, then what our consumers told us was something very important. They reconfirmed, and I know this is a little hard to see, it's the data geek in me, so apologies, Molly. But I mean, what we found out in this really, what they said, if you look in this box here, and we'll get you the slides, the fact that people attended to my own needs were the things that people said were most important and most significant in what happened. If you look at some of the areas where there were lower scores, in particular, and strongly agree, it was they had time for me, or they rushed their conversation. When we broke that sacred promise, that sacred connection of human being to human being in care, is when we missed the opportunity to ultimately drive the best in outcomes. And in fact, what we found is that people, I think relevant to the conversation, are now really wanting to see more virtual care. This was prior to virtual care even emerging on the forefront of the COVID crisis, this ability to engage in virtual care as well. So as we kind of think about where this leads us, what we've seen is greater technology implementations, greater connection with people, and finding a way to do that with a sense of human connection has been so important, because what we found is we looked at what high-performing organizations were doing. What we asked them, to them too, was about how patients were treated and how we communicate, how we ultimately build effective teams within our own organizations and drive the quality that matters. So as we kind of tie off this conversation around the first piece of this, Molly, around what experience is and why it matters and why all people matter, as we then begin to transition to how it matters in the environment in which we find ourselves, we realize, and I can tell you from an operator as well in my old days, that experience is the one thing ultimately that can drive all the things we aspire to. Clinical outcomes and financial outcomes, consumer loyalty and community reputation, and now even new customer attraction and engagement and retention of our own people. When we focus on experience as a macro strategy, as something that matters to all, then I think we're doing that. See, we far too often, and I've been guilty of it as an operator, have built a transactional healthcare system, chain after chain after chain. And we've tried to make it relational by putting all these processes and pieces in place. But instead, I would assert that I think we need to build a system that is relational, and that we build the right transactions. I think that's what's so powerful about it. And I appreciate our sponsors even today, because the technologies and supports that they put in place are really about ensuring a relational system can exist with the right kind of transactions to support that in happening. And I love this quote from a dear colleague, Shannon Connor Phillips from Intermount. She said, "We can't give high quality care without having a relationship with the person in front of us." And that doesn't necessarily anymore mean the person physically in front of us, but that opportunity. So we are releasing soon, and I know we shared this, Molly, a paper on maintaining human experience in a new era of virtual connection in healthcare. It's actually not even out yet. So we're going to give everybody on the webinar a chance to access that early as it is released. But I think it's based on this idea that healthcare's tomorrow started yesterday. It's exactly what you started off in saying, Molly, as we began. Because the story that I'll end this section on is this. There was a nurse who, there was a patient, in a bed who knocked over that small water cup onto the floor next to her bed, and water spilled everywhere. And she was worried. She was a fall risk, so she pressed her call button to let the nurse know, pressed her call button, pressed her call button. The nurse showed up in the room, looked at the spill, looked at the patient, and went to the phone on the wall. And who do you think she was calling? Right? Environmental services or housekeeping. So moments later, here, and that squeaky bucket shows up at the door. And the housekeeper looks at the spill on the floor and looks at the nurse, looks at the spill on the floor, looks at the nurse, and then does one of these with her finger. "Come here, please." And in the room of that patient's room, right in the doorway, the world's largest whisper fight breaks out. And what do you think they were arguing about? Whose spill it was. "No, that's a nurse-sized spill. You shouldn't have cleaned it up." "No, that's a housekeeper-sized spill. It's your job." In the middle of all this, who's watching? The patient, their family member, their colleagues in the hall. So in the middle of this argument, all of a sudden they just hear, whoosh. And as they turn around, they see the patient now in the bed with the pitcher of water that was next to her bedside table turned upside down and water everywhere. And she just looked at them squarely in the eye and says, "Is it big enough for you now?" And that is all that patients and families are asking of us. That is all our people are asking from us. And I believe that's why this conversation on engaging our people, the process we put in place in technology, is so essential to where we go in framing human experience and the patient experience for all. So I think that leads us a bit into conversation, Molly, like some food to chew on as we move forward. So I'd love to know thoughts or questions that we might have.
Yeah, no, Jason, I think that story is very powerful. I think it leads to one question I have for you, which is, given that one slide too showed how so much of what matters to patients most is relational versus the amenities, as you said, the things that are expense items. So when it comes to hiring and looking at candidates, are there any qualities or traits that HR managers or hiring managers should keep in mind? That the people coming aboard are upholding those values?
I think it's a great question. So I will have to own I'm also an old HR guy from way back in the day. And, I think we've all talked about the right behaviors and behavioral expectations that we have from people. But I think you really need to find those folks with really high kind of emotional intelligence that are empathetic and compassionate. I think the conversation, and we've heard it everywhere, not to be trite, you can train for skills, but you need to hire people for the behaviors that you want to expect. And so you need to find people that are anticipatory in action, that are willing to be responsive, that have that sense of compassion and empathy that they bring to their work, that are agile and are able to see things like the food service worker that I mentioned, that was able to hear something, adapt, and then adjust, and actually provide an uncomparable experience to this patient who was now more engaged in their care and probably got better clinical outcomes. That's how all of this connects, and I think so vital to our capacity for engaging people in that way.
Absolutely. And something else too I was thinking about in your remarks is how important it is to have psychological and physical safety and security before you start building upon any other layer. Really hinges on whether that is present or not. And I was thinking too about we've seen some stories as of late at Becker's about technological insecurity and patients' records being accessed in an unsecure fashion and so forth. Can you talk a little bit about how that comes into play with the patient experience, that privacy and secure access to their records and information about them? Do you have any thoughts on that, Jason?
Yeah, I think that's essential. If you go back and you look at what was found in that one data point, it was too small to see in the PX Pulse, but it really was the one thing that people said that they appreciated was when their privacy was respected. They were cognizant of it. I think patients and families, I can't even say we are, right? How our records are exposed, the realities of data and where it lives today. I can say that patients want, more often than not, open access to their records. So are hiding them from them or us putting a boundary between their access to their information is also problematic. But I think that letting them know the right security protocols are in place, ensuring that they can access those records in a way that are secure. It is very personal. And I think as we saw in all of the data that we talked about, people's personal connection to their health, it's about my health first, is also about everything that it makes them vulnerable, that exposes them not just from a health standpoint, but from a personal standpoint as well. And I think if we are not mindful of that and don't put the right infrastructures in place, patients see that. They are aware of that. And they watch the news of data breaches, and they see how our hospitals have let records slip through their people's fingers. And that is not comfortable. And if we're talking about exactly what you said, reinstilling trust in our health system, it's vital for our capacity to move forward, I think.
Yeah. Well, thanks, Jason. That's it for my questions right now. I know we'll have more at the end of the hour, but why don't you dig into part two?
All right. Thanks for the breather and the sip of water too, Molly. And I think those are great questions. And I think that does really, they lend themselves in a way to this conversation around our current reality. So, if we believe and we kind of all can ground ourselves in, and why I spend time trying to get us centralized around and aligned around what experience ultimately is, that we're not just talking about making patients happy or doing what they want. That's not what this insinuates, right? It really is about doing what we believe will drive the best outcomes for them, for our organization, for the people that serve our organization. We have to really shift our perspective and thinking about where we go from here. And I think that this current crisis has helped us to really elevate those if we want to look for the silver lining in what we are going through currently. I think, it's not what you look at, what matters. I love this from Thoreau. Really, it's what you see. And I think so often we can look at the crisis, we can find those things, but what we're able to see in this, what we're finding from this current reality is pretty profound in reinforcing this idea that every role matters and that we have to ensure that that is fundamental to this conversation. So I would only say that as we look to what's happening in healthcare organizations today, the connection of the people who have showed up and tried to make that personal connection between layers and layers and layers of personal protective equipment, the celebrations that we've seen from people in our communities, we have seen real core practices evolving in this discussion. And so I think as we've looked at elevating human experiences, we've looked at the impact of why every role matters in this era of COVID in particular. We've seen all the things that were relevant before elevated to an nth degree. That we're thinking about the basic things, like we have to have equipment availability, we have to redeploy people, we are trying to maintain human connection while shifting visitation policy that makes people uncomfortable. There is fatigue and burnout that you alluded to. There's strain on mental health, and clearly now new delivery models of care that are emerging or expediting in their arrival that we knew were needed. But there's also basic needs, and I think we talked about this even before this rose up, to the basic needs of our own staff, the human needs that they have, and really the social equity issues, the inequities that we see that were elevated as part of this conversation came well before even the more recent statements, and I think powerful statements around how we have to address that as a society globally. And what that really leads me to want to share a bit is about, so what does that mean for this future of human experience? If we believe this matters, experience matters, and we have to care for human beings, and we look downstream, how do we take the realities of today, the foundation that we built on, and move forward? And I think the simple piece for me, and if you can tell, I'm into human beings, I guess, right? But I mean, what's essential to us as human beings is also essential for us as human beings, and that, you know, we have to come back to this idea that as human beings, we're caring for human beings, and why I believe we come back to the idea with that, and the premise of our entire conversation today about that every role matters. And I think for me, first, there's kind of three layers if we look at it this way. I'm going to share a bit about some foundational changes I think we need, about what it means for how we build some structure to it, and then a line of sight to the future around then how we move into a new existence that will tie, I believe, all of this together. So we need a change in perspective first and foremost. I think we are moving from siloed and specialized care to integrated and systemic care, and having the right people, process, technology in all of these areas to link those together will be so critical. We're facing a change in process. And as we talked about, this ability to think about things, as I mentioned before, and I think our bridge from the earlier conversation, from what was a transactional system of care to a relational system of care, and building the right infrastructure to deliver on that. And I think also what we need is a change in focus. And I would say that we have been aspirational for often. I mean, we've said, oh, telehealth is coming and all these new technologies might help us, to real active. I mean, we've seen our capacity to move now in things that we've heard people say would take years to do. And I know we have a lot of technology folks on with us. I mean, kudos to you. Congratulations for the things that you have enabled your healthcare organizations to do in days that you anticipated would be months and years. And you have done it not just because it was the nice thing to do, but because it was the right thing to do, the needed thing to do, and you did it with possibility and purpose in a way that really helped the patients and families you were caring for and the staff who deliver care each and every day. And that shift is really then grounded to me in sort of a sustained commitment to some key things. We are going to have to address policy. I mean, things like how we reimburse for telehealth, for instance, in the United States, or the way we structure virtual visits. We're going to have to think about how we reframe measurement. You know, the simple satisfaction surveys and the ideas of what matters to people is being reframed, and how we measure that will also have to be fundamentally rethought. And then I also think that we're going to have to expand what we think about partnerships. We can no longer operate as individual healthcare organizations, but have to think systemically as communities around what that means, how we connect beyond even acute care space to our sisters and brothers in long-term care and home health, because that connectivity, that connection is where we not only combat a crisis like COVID, but ultimately elevate the health and well-being of our communities overall. And bringing health to where people are is going to happen through partnership as well. And I think that really does lend itself then to, if every role matters, a future of human experience that we think will be fundamental. So we went through an inquiry process. We've engaged people globally in all of this process and came up with around 6 core statements, first around patients and their care partners, around the workforce, and around community, that we believe will guide us forward into what I will say then is acting into new existence. But we're going to have to look at consumerism in a new way, to one of partnership. We're going to have to provide what I've been calling precision experiences that meet the needs of the individual and what their specific needs are from a patient and caregiver perspective. From our workforce, I think, as you were alluding to, Molly, this need for us to address the process burdens and the workload issues of healthcare workers. And I think we're also going to see a transformation in professional models for new healthcare workforce. We're going to see a change in the way we educate people with interdisciplinary lenses as well. And then ultimately, it's about our communities, that we must expand beyond treating illness to addressing health and well-being of communities. And that does get to the very essence of the health inequities that we're seeing. And then we have to meet people where they are, where they need it, and follow them where they go. I mean, healthcare is going to change transformationally. And these are not things we didn't know, but these are things that we're being called on, truly is what I would say, to act into the new existence of where we go and thinking about what experience will ultimately be. And as we had conversations with our community, many of you are here on this call, we realized that as we think about new existence, I call it a project. It is a work in process. And there's not just a stake in the ground to say this is what will look like, because it will be forever evolving. But I think you alluded to a lot of these things in your initial message, Molly, that we have to establish and reestablish consumer confidence. We have to recharge our workforce. We have to rebalance our care models. We are going to be looking at sustaining the practices that worked and capturing the lessons that we learned. We have to lean in on the policy changes that will support that. all at the same time, we still have to honor and acknowledge those that we lost, and we have to prepare for a reoccurrence in some way of the current crisis in which we find ourselves. I don't think you can talk to a healthcare leader out there that it doesn't have their reactivation plan either in process or already built to acknowledge that this is not going away, but this is ultimately our new existence. And that's where we find ourselves, I believe. If we're going to engage all voices kind of on the social economic implications that we've addressed, we're in this delicate balancing act of managing the crisis that we find ourselves and planning for the future. And we're going to have to be in that way for a while. And so this ability to link those things, as I said, is not a new normal. I'm not a big fan of those words. I don't think this is a normal time for any of us or anything that we would be deemed. And I don't know that there's necessarily a new normal where we will ultimately land either. But I've been saying it's a new existence, right? It's really a way of being, the way we will live, how we're going to be driven by our survival in healthcare. When the things that we're hearing are, we have to try to reopen our organizations, but we have to manage our financial implications of our current state. We have to care for those that are currently being addressed, that are addressing COVID illnesses and plan for resurgences. I mean, these are multiple and significant pressures on our organizations. And so it only elevates the importance of why our people matter and why we engage their voices in the work that we do is so fundamental. So we really engaged the broader community globally around what it's going to take. And I'm going to share, it's kind of compressed in one slide because I thought it would be easier to talk about. I know maybe hard for some to read, so I acknowledge it up front, but I want to highlight a couple key points that bring us back to where we started our conversation. That when we begin to think about to care as human, about when we think about every role matters to the experience, and we fundamentally acknowledge experiences, the sum of all the interactions that people have, we have to think about some fundamental and complex actions that we'll take. So this list in front of you is 15 right now that we're actually in the process of validating through our global community, but it touches on all the things I think you alluded to start, Molly, and I've shared. It is going to be about how we address health disparities and establishing a lasting system for virtual care. We're going to have to reinforce speed to innovation and make sure the voices of patients and families and their care partners are forever part of an active part of the conversation. That we think about our access and visitation policies from now on in a way that actually balance both clinical and safety needs with personal needs of families. And we understand and elevate the essential role of care partners and caregivers in ways we haven't before. We have to, I think, as you were alluding to, elevate consumer confidence and really ensure that the fears that people have now back to healthcare are assuaged, because that's going to be what enables us to ensure we have sustainable and viable financial institutions of care moving forward to be able to provide the care that they want. And then to the points you touched on around caring for our healthcare workforce, both because of stress and trauma, burnout, and the resilience that they must build, but also for the appreciation and recognition that we've seen and need to sustain through and beyond this crisis. I think we have to open up to more open and transparent communication. Back to your question around what characteristics are so essential at this moment. I think what people said more often than not, what I've heard them say again and again, is that at this era, I heard more from my leader. I was communicated more clearly than I ever have been in my many years at this healthcare organization. That transparency of communication, that openness of message, that connecting people in care was fundamental to the success for many organizations during this crisis. And it is then leading us to better collaboration and alignment. And as we talked about, not just in organizations, we broke down boundaries and silos in healthcare in ways that we didn't believe were possible in the last 10 weeks. We've also broken down boundaries between organizations that were probably years ago, if not months ago, competing for volume in the same geographies. And what we found is this capacity to collaborate and elevate the health conversation and the well-being conversation in our communities has changed our capacity to do that. And it extends beyond just hospitals to non-hospital care and long-term care and home health. We have to think about healthcare now as an ecosystem that needs to work together as one. We have to continue as that, then to engage our community in the things that matter and support the needs that our communities have as members and vital members of those healthcare communities. And then I think coming back to what you started with as well, that we're going to have to and really work diligently to address the importance of emotional well-being, of the stigma associated with mental health and how we prioritize that. We've seen it both for people that have lived through the crisis on the patient and family side. We've seen it clearly in the resilience challenges to those who have provided care as well. And if we believe ultimately that the human experience matters, that all people matter, that we have to reinforce their capacity to do that, that we need to provide the right structure and process and the right technologies to support them, these all have to be priority actions for us. And yes, this is the elephant, I will say. I heard someone say that. I mean, and we're going to have to bite it off in chunks, but all of these actions are going to be fundamental for our capacity to drive outcomes in this experience overall. So I'll share a story briefly. And there was I'm an old track guy, and I guess I'm just old first, and I had a great track coach, grew up in the Hudson Valley of New York on those hills, for those of you that know them. And he was James T. McGinley. He was an ex Marine sergeant, fought the Korean War, and was now our track coach. And he would literally drive us around the Hudson Valley and find a hill, something like this. And he would drop us off at the bottom, and then he would just drive up to the top in his little pickup truck, and he would just yell down, "Run!" And we'd run up the hill, and most of us would get close to the top and start like, and he'd look at us just with his sergeant look and say, "Back down, do it again." And he would yell, "Run!" And there we go, running up the hill again. Get close to the top, we'd let up, take a breath, and he would look at us again, not say a thing, send us back down the hill. And finally, about the third or fourth time, he'd look at us and say, "What I want you to do is run over the top of the hill. Because everybody else you're competing against is going to stop when they think it's time to rest, when it's that crest, when it's that moment to take a break. But if you're going to push ahead, if you're going to succeed, if you're going to overcome what everyone else is struggling with, you push over the top. You run over the top of that hill." And from that day ever, even into my old age where my knees don't want to work, do I run over every top of hill that I see. And this is so relevant for where we find ourselves today. That what we're being asked to do in healthcare is not simply get to the crest of something. We're going to have to run over the top of the hill, not necessarily knowing what's there. And if we are willing to do that, if we're willing to align our people in ways that matter, if we're willing to implement the processes that support us, if we put the right technology in place to support us in doing that, then I truly believe everything is possible. You see, where we go from here, where we take this conversation, is making some fundamental commitments of ensuring that all voices in healthcare are heard, respected, and acted on, that we advocate for the practices and policies that will make a difference, that we address the systemic issues that have been so elevated during this time, to ensure the health and well-being of all citizens around the globe, and that we co-create a future together where the possibilities that we have sprout from these deep roots of human experience that we build together. Because as we started, I think I will end. We are human beings caring for human beings. And I believe our commitment together is really the commitment that we've called for, even from our days and through our life here at the Institute, is that I believe we can and we will change healthcare by ensuring an unwavering commitment to the human experience. If we believe to care is human, if we believe that every role matters, if we understand the opportunity that we have, no matter what our role is, to impact this work, then the outcomes we aspire to, the opportunities that we have, the possibilities for healthcare are boundless. And I remain inspired by seeing everything that everyone that showed up today to listen does each and every day in delivering care for people in need. That's what we're about. No matter what country we are in, no matter what position we have, that is ultimately our opportunity overall. So Molly, with that, I think I'll leave us with food to chew on. We have some resources that we addressed as well today that we can access. And then I'd just love to gauge thoughts, see what questions we have, and really appreciate the chance to just share some of my crazy thoughts with you today.
Yes, no, far from crazy, Jason. I mean, I feel like we're 45 minutes into our webinar, and so you're off to the races. You've just been sharing so many powerful insights and information with us, so thank you. It's a great time to answer your questions you have for Jason in the box on your screen. Before we get to attendee questions, Jason, I wanted to touch on something I had mentioned in my opening remarks, which is the fact that Americans, this is a really, these are heavy times for Americans, period. A few months ago, if we had had this conversation, I still would have brought up burnout with you, and how among a backdrop of burnout, you can expect people to provide a really exceptional patient experience, even 4 months ago. But now you look at clinicians and providers and how they have not only been affected by this virus themselves with the risks they face, but whether it's colleagues contracting it, colleagues passing away from it, family members, amid a backdrop now of some serious civil unrest, and that's just affecting everyone, regardless of profession. So do you have any insights as to how to ensure that these expectations for an exceptional patient experience aren't exacerbating the burnout and the effects that people are feeling right now at work?
Yeah. Here, so I would say this, and I think I love that question because it gets to the essence of our entire conversation. If we see providing experience as something that we do, then it is a burden. If we see the experience we provide in healthcare being who we are, then it is everything we do every day, and it's not. And so I think when we begin to make this about the techniques and the practices or the things we're supposed to do, that's when we have the easy enough excuse. And I've seen it, and I might have even been guilty of it in my days of administration, of saying, oh, we'll get to that later. But the reality that every interaction that we have with people in healthcare is actually a part of their experience, whether they're a provider or whether they're a patient, changes that equation fundamentally. Now, that is not to diminish the burnout that I think people have. I wouldn't say that it's the provision of experience that necessarily leads to that. It is the provision of care in the situation in which we find ourselves. And I think this idea and I think the element of burnout that we've experienced of late has been to a level we couldn't have anticipated. And at the same time, as you alluded to, right, we've been talking about this for a while now. And with the burnout of nurses, the burnout of physicians, the burden that they feel that they carry, whether because of processes operationally or volume of work that they need to conduct just to make certain, meet certain metrics or numbers. And I think what we have to do, and I think I'm seeing us do that in this crisis, is make that not a bad thing. Acknowledging that it is okay to be overwhelmed. It's not okay that you are, or that the system got you to be overwhelmed. And sometimes we can't do anything about it because we're in a crisis, but it's okay to acknowledge when you're overwhelmed. Number 2, that you feel burnout. Number 3, that you feel strain. Number 4, that there are mental strains that you're going through. What we did is we made it a thing that was bad. And so a lot of these folks just compressed it or hid it or didn't elevate it. And what this crisis did, I think in a lot of ways, is cracked open things that we've kind of kept beneath the surface. So we have to be willing to let that out. We have to acknowledge that that exists, and we have to then address it for its reality. But letting providers, letting nurses, letting our caregivers express their tiredness, their overwhelmingness. I mean, these respite rooms that you've seen show up across healthcare organizations where literally caregivers, care providers can go in there, put their head in their hands and simply sob is so important. And acknowledging that's not a sign of weakness, but a sign ultimately of their strength, because this takes a lot of work. And so I don't want to conflate experience efforts with stress on burnout, but rather it is the whole effort to provide the best in care, which to me is the experience, quality, safety, service, managing cost, outcomes, all of that. And how we acknowledge that burdens people and how we address it will be so fundamental. And so I think it's such a critical question that we can't let get lost in this moment and not also just seem as a symptom of the COVID crisis. It's not. It's fundamental to healthcare and something we have to structurally change moving forward as well. So that was really not a short answer. I apologize, but I'm passionate about that one.
No, and can you repeat the first thing you said was, if it's seen as something you have to do, it will exacerbate burnout. Can you repeat that line? It was your opening statement.
Yeah, I mean, I think what happens a lot is we see the experience, so that's just something else I have to do, right? Experience is a checklist of the things I got to round, or I got to speak these certain words, or you see experience, no matter what. Right now, if we didn't talk about experience at all, people are having experiences in healthcare. We don't do it. It's there. And so the problem is a lot of organizations made it something to do, so it became a thing that could add burden to people, when in fact they're doing experience no matter what. It's getting sure, like we talked about, the right people are in place, the right processes are in place, we're using the right structures and systems to deliver care, and we know what's important to who we are as an organization. So the less we make experience about what we do and the more we just say it is who we are as healthcare, changes the conversation. But then I think we can realistically address burnout as well. Because burnout comes from so many places, and I don't think we can point a finger on one thing or another. There's a right. For the technology folks, you probably get tired of them saying, you got me charting at 3 a.m. because your HR system. I mean, we know it comes from all these different angles. We have to address it systemically, I guess, is the key point for me.
That's a great point. I think it leads into my next question, which attendee had posed, which is, let's assume that this attendee either leads or works on a team where the common understanding and culture is that patient experience is something you have to do versus who you are. Would you have any guidance or tips for how one person can go about inciting that change, where it's seen not as something to do, but who we are? Do you have any guidance, either at a peer-to-peer level or a leader to report level?
Yeah, I mean, I think I think a lot of it has to start with conversations. I mean, it's going to sound overly simplified, in particular in the moment, but it is a bit of a social movement inside organizations. I mean, for a lot, people see, and particularly in the United States, experience as how you scored on CAP scores. And if that's where you are in defining experience for your organization, you're in a very wrong place. It's a metric of some ideas of experience. And I'm not saying that that's a bad way to gauge. It's a common foundation to gauge. But I think that what that person, if we're stuck on, it's a metric or a score versus the things that we do, what we believe our patients and families expect of us. So if I'm talking to that person, how are you showing your peers? We need to find out what Mrs. Smith in room 301 really wants from us. She wants to be communicated with about when she's going to be discharged. We missed that chance. That's her experience. And that experience will clearly lend itself to the way that she rates us later on. But it's those moments. How do we create those moments of personal interaction? I don't think anybody that I've ever spoken to in healthcare, at least, has said, this is the profession I picked because it was the place I was going to get rich quick, right? People choose healthcare for their purpose, for their commitment to other people. And I think we've buried that sometimes with all the processes and things that we put on top of people. So to be able to peel that back and help those individuals find the real simple, basic points for connection to not just only their patients and family members, but to each other, to have honest conversations, to listen, to ask. And like we said, those three things that consumers want: listen to me, communicate in a way that I can understand, and treat me with dignity and respect. Those are the same things we want as human beings, no matter whether we're a patient, a coworker, or somebody walking the street. And those are the things where I believe if we start, we can begin to change the way people look at this overall.
So it sounds like for that attendee, get ready, have a series of conversations. It won't take one. And it is, like you said, Jason, going to be somewhat of a social movement internally.
Mm-hmm. Right.
Okay, this next question is a few statements they're seeking your comment on. The statements are: worker experience has a great impact on patient experience. An unhappy worker will not attend to the experience of the patient. Please comment.
Yes. Yes, you're correct. I mean, that's the whole point of this conversation. This is not, I think if we think about patient experience as simply about the people that we serve, then we've missed the point. I mean, when we think about what human experience is, if we don't care for our workforce and we do everything we can, as we said in that definition, it's built on the kind of culture we build. If we don't create a workplace that works for the people there, they're never going to be able to provide the kind of quality, safety, or service that folks expect from us. And so we can checklist ourselves to death in healthcare and never provide a good experience. We can checklist ourselves to death in healthcare and never provide a quality experience if we don't have the right people and care for those people in a way that matter. So if we don't put the people who show up every day to contribute to the healthcare system, whether they're in the basements preparing food trays or inserting an IV, then we've missed the opportunity to actually ensure the best experience for everybody. Because if we're not caring for our people, then we can never care for the patients that show up each day.
Boy. Lots of great questions coming in, Jason. Attendees, if you have any others that you haven't yet voiced, please do feel free to contribute them in the Q&A box on your screen. This next question, Jason, has to do with the times we live in, which are socially distant. How can we ensure patients have a positive experience and they feel connected from a distance, such as during virtual care? Any insights there?
Mm-hmm. Yeah, I think there's a simple technique that I always thought was so important, whether in person or virtual. Ask them what they need. We always jump into the protocols and our processes. When you're on a virtual call, when you look at the numbers, I'm sure a lot of your organizations experience this, that we're at maybe 10, at most 12%, 5% virtual to all of a sudden 85% or 90%. And we just jump into doing the care. Are we taking a moment to ask people, how is this working for you? What can I do to make this encounter more personal? What do you need to know from me? It's okay to take that extra minute. It's okay, because that extra minute to just find that out will so far improve that interaction, engaging that patient in the clinical needs that they have, understanding what the realities are that they're facing. If we just jump into our routine because we just got on a computer screen like we're sitting right now and just start blah, 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 then we miss the chance to really know what's important. So I think we just have to stop, take a breath, and ask, how is this working for you? What would make this encounter more beneficial to you? What do you need from me as we work through this virtual visit? And if we can ask those questions very simply, then I think we change the nature of that encounter, which I think has long-lasting effects for the patient and really for that provider or that clinician that's engaging in that discussion as well.
Mm-hmm. And Jason, too, by asking that question, do you think that the patient or whoever is on the receiving end of that question is more likely to even be forthcoming about some other experiences they're having right now that maybe are influencing how they would receive your interaction and your care and really set the tone? Yeah.
I mean, I think it's a great example. I mean, I don't know for you, Molly, but for me, all these calls that I've been on, whether they've been Zoom calls or conference calls or webinars, people right now at this moment have the need to say stuff. And I think our patients always have. We are feeling things. Have things in our way. And our patients in particular that, as you alluded to at the beginning, are carrying incredible fear. They're trying to decide whether they can come back to our hospitals or our healthcare organizations. They want to be cared for. People are holding off care because of those fears. Things will come out. And if we avoid those things, they will forever be lenses that filter the interaction that we're going to have with that patient. We might not actually get to the essence of what's in their way. So it's our ability to create that kind of connection and be willing to say, okay, I asked a question and now things that I didn't really need to know or want to know are coming out. That is actually vital information to caring for somebody. And often we're so busy, we don't get to that. So I think we've been given a gift in some ways that people want to be heard. And so we need to be willing to listen. And yes, if we're checking off that virtual visit should only be 3 minutes or 5 minutes and they go 7, but we know the outcomes are going to be better because they went that extra 2 minutes, that it shouldn't be the time that we check people against. It should be the quality and the connection that we create, because that's going to create the lasting health outcomes that we're aspiring to, I think, each day as well.
Mm-hmm. Jason, this next question comes from an attendee, and it gets at your work, but how are you connecting with hospital and healthcare leaders to get this message out?
Well, from our, I feel very fortunate. I mean, coming from the hospital side myself, I mean, we have a community, as you noted early on, of 55, 60,000 people around the world. So, I mean, our community, the voice, the things that I share with you are not just simply Jason sat in a dark room and came up with them. These are the shared collections. These are the focal points of a community of people that are living, like each and every one of you, these issues each day. So the message is being disseminated through that community, through our avenues of opportunities like spending time with you today, Molly, and our journal that we publish, or through the white papers and webinars that we provide. But what's really important is that what we find is people are sharing the other questions with themselves, and people are having these conversations that are vital. So I think the ability to have the conversations, and for us, it's really been the dissemination of information as best as we can, but showing up for things like this. Like, I'm so humbled and honored to be invited just to share these thoughts with you. This is how we get the message out. And I hope each and every one of you take a nugget. That's your seed to plant for your next conversation. And we create that ripple effect that I think ultimately impacts the human experience overall. So I appreciate that question.
This will be our last question, Jason, as we get ready to close here. But I think we're all doing a lot of listening and learning right now. What resources do you recommend for healthcare organizations to learn more and keep this conversation going?
It's interesting. I would say first and foremost, each other. It's going to, we're doing great work right now in care organizations. And so we have to be willing to share those stories. We have to be willing to public our successes and failures. We need to be willing to engage in our lessons learned. So can I reference you to one document or one thing? No, there is so much going on right now. I mean, that's been, I think, the positively exciting challenge we face as a community, because we are kind of collating all of that information at the Institute. So I would be remiss in not saying we have a great repository of those practices. We actually, as I alluded to, have an open call right now for our journal where we're going to codify cases and stories that people have lived through and want to share as part of that. My suggestion is share, and you will be shared back with. If you have a story to tell, a case of success, a challenge you overcame, find your colleague, find a friend, find an outlet. And it's going to be in that community of ideas that we ultimately find the best references. So I'd offer clearly the Institute. I think, Molly, the things you all are publishing from Becker's are right on in terms of getting people the information you need. But I couldn't name one source in particular that would say this is the one. Be willing to learn from each other. That is what human beings caring for human beings is all about.
Mm-hmm. So listen and learn and share with one another. Jason, I want to thank you so much for your valuable insights today. You really packed in the material and gave us a lot of food for thought. How to restore and support the patient experience during this challenging time. So thank you so much. I also want to thank our partners, JobVite, Perfect Serve, and Secure Auth, for making this conversation today possible and supporting learning opportunities to improve the patient experience. So in closing, and on behalf of Becker's Hospital Review, stay safe, stay healthy, and we look forward to having you back again with us soon. Thank you very much.
Thanks all. Thank you so much, Molly.
Thank you.